Welcome back. We're continuing our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert and Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio is back with us this week to help us get answers to your coronavirus questions. Dr. Berggren, thank you for joining us again. The first question has to do with testing capacity. I mean, the good thing is the requirements for testing were loosened, so if you have the symptoms, you can get a test. What is San Antonio's testing capacity, and what is the turnaround time like getting results?
So, we have been lucky compared to a lot of cities in the United States because we've had the capacity to do an additional 3,500 tests per week funded by the federal government. That's the testing that's available for free down at the Freeman Coliseum. The turnaround time has been slow. The turnaround time is quoted as being 4 to 5 days. It could be even longer. And that particular 3,500 tests a week capacity that we were given will only be up until the 10th of April. But in the meantime, a lot of our private labs have come on board, and there are a number of places where you can get tested now, including at UT Health, of course, Texas Med Clinic. And the turnaround time, though, is still slow for most people. We're quoted 4 to 5 days. I sent a patient for testing on April 1st, and I am still waiting for the commercial lab to give me that test result. Today is April 7th, and both the patient and I are very eager and very concerned about that test result. Now, I want to tell you that at University Hospital, we have a variety of different kinds of tests for COVID that are available thanks to the efforts of our incredible laboratory personnel. And we actually can get about 130 tests a day done. I think that's roughly our capacity in the hospital. And we can get a 24-hour turnaround.
Wow.
However, that 24-hour turnaround is reserved for special people, the sickest people in the hospital, as you might imagine. We really need to know quickly if a patient in the hospital has COVID-19 or not, because we've got to segregate them, isolate them from the other sick people in the hospital. And the other group that are prioritized for this more rapid turnaround and test are, of course, the healthcare workers. Because if we don't know if their fever is due to COVID, then they're out for a long time, and we start to deplete our healthcare workforce. If we can test them and find out that they're negative, then we can get them back to work and on duty much more quickly. So we do have this capacity for 24-hour turnaround, but it is focused on the sickest people, the hospitalized people, and the healthcare workers. And this is going to change, Steve. It's going to get better. We really believe it's going to get better, and that's because there are multiple different kinds of tests that are available and that are coming online. We'll still be limited by shortages of reagents, because we have to share, across the country. But we are making progress, and the turnaround time is going to get better.
Good. That's good news. All right. Ways to keep healthy while social distancing. I mean, exercise is important for a lot of different reasons in this whole thing.
Absolutely. And we've got great weather here. Springtime is always so beautiful in San Antonio. And I see people in my neighborhood getting out and walking, and they're doing it appropriately. They're walking in family clusters, and they're not congregating, and they're having a good time. So get outdoors, walk your dog, shoot some hoops, but don't get too close to other people. I also think that people need to think about their eating. Thankfully, we have good food supplies at HEB. I know the lines have been long. I know that it's been hard to get eggs. I had a hard time getting eggs. But still and yet, we have a really solid, steady food supply. And so people should be trying to eat healthy foods, you're home more, cook some of your own food, cook healthy vegetables, eat well, exercise, and just continue to follow the rules about the social distancing. And of course, now we have this new recommendation, which I strongly endorse, which is that we wear masks and cover our nose and mouths when we are out and about. Doesn't have to be while you're exercising, as long as you're social distancing, but it does mean when you go to the pharmacy, when you go to the grocery store, those kinds of places, you need to put your mask on, cover your nose and mouth so you don't infect other people.
All right, our next viewer question. Can San Antonio COVID-19 survivors donate plasma. I know there's been a lot of speculation that maybe the blood and the plasma from these survivors could be used to help some of those people who are fighting the disease right now.
Right, so that's a really important question, and it's being studied right now. And an announcement has been made that in this community that our South Texas Blood Bank Center is willing to collect plasma. As to how it gets used, that's still being worked out, but it may in fact prove to be something that's important. Regardless of whether it goes to that purpose or not, we still need people to be donating blood for our blood supply, because that was something that we were notified early on when the shelter in place or the stay home orders came about, was that we were seeing a decline in our available blood bank supply. And of course, we need to keep that up. So donating blood is a good idea for either one of those reasons.
Yeah, and it's a great way to help when you're at home and you're feeling helpless and you wanted to help in some way. Make a mask, donate blood. There are so many different ways that you can help. All right, next viewer question. Would the pneumonia vaccine have any protective factors against COVID-19?
There's no reason to think that that's the case, but if you're a person who falls into the category of a guideline, you need to get that pneumonia vaccine, you should get it. And so that certainly applies to folks over the age of 65, people who have some sort of condition such as diabetes or kidney failure or HIV that causes them to be immunologically compromised. We have guidelines for who needs to get the pneumonia vaccine. And if you haven't had it and fall into one of those categories, by all means get it. But there's no reason to think that that's going to protect you from the COVID pneumonia.
Yeah. Next viewer question. I have asthma, diabetes, and congestive heart issues. What is my actual risk factor if I go to the store and use precautions?
So I can't give you a number for that question. I'm glad you're aware that all of those underlying conditions put you at risk for a worse outcome should you become infected. But you do have to live and be a human being. And so you need to go to the store. You need to get your meds picked up. Maybe somebody could help you. That's always a great thing if someone else can step in and help you decrease your risk, provide you with some mechanisms for harm reduction. But when you do go out and you're buying your food, wear your mask, wear gloves, wash your hands, and if you have it, use hand sanitizer. I keep the hand sanitizer in the pocket of my door of my car. I sanitize my hands coming in and going out. I rub it all over my hands, and I rub it on my steering wheel. And then I wash my hands for 20 seconds when I get into the house. So just keep doing those things. And if you are someone who is medically vulnerable, you might be a person who reaches out to a neighbor or a family or a friend and says, hey, when you go to the grocery store, could you pick up my groceries too? Or you maybe want to take advantage of the online ordering that exists. If you have internet, you can order your groceries online and pick them up curbside. So those are some of the options to decrease your risk. And so I'm glad you're thinking about it.
Next viewer question. If members of my family are self-quarantining, should I?
So to unpack that question, we have to think about the difference between isolation and quarantine. Quarantine usually means that you've been exposed, and so you're being isolated at home to observe whether you're going to develop fever and become ill. So perhaps you've just come in to San Antonio from a high-risk area, New York or Italy or someplace where there's a lot of transmission. You're quarantined. That doesn't mean that the people in your home need to quarantine also. You need to separate yourself from them. A different story would be isolation. So if you've actually been diagnosed with COVID or you're being tested for COVID, we're waiting for a test to come back for you because you've got symptoms. You are now in isolation. You're in a room by yourself, ideally. You're using your own bathroom. You're masking when you're in the presence of other people, and you're really staying away from everybody else. The people in your home should be very careful. And if they have to go to their work, they should be masking, as all of us are. But unless there's a clear evidence that they've been exposed to you for a long period of time, they don't necessarily, certainly don't have to isolate. Okay, quarantine would be good, but we don't necessarily quarantine everybody in a family just because one person is in isolation.
Yeah. Okay. Last couple questions have to do with numbers and kind of your perception on what's happening out there, what you see with the numbers, because I'm sure you look at them totally different than the way I look at them or the average person looks at them. Do you think social distancing is working? Are you seeing evidence that social distancing is working?
Yes, and the reason I can say that is that the predicted peak keeps getting moved out longer. And so that's a good news, bad news story. We want to hear that this whole isolation, shelter at home or stay home orders are going to be over soon. So we want to hear that the peak's coming and then we're going to get it over. However, the longer it gets put forward into the future, the lower that peak is, which means fewer people sick, fewer people in the hospital, and fewer people dying. And there's a resource online which I think is very credible and is encouraging, Steve. And I'd like to suggest that people go and look at Community Information Now, CI Now. It's online, and they predict that by the first week that we stayed home here in San Antonio, we saved 1,271 lives.
Wow.
And if you accept that for 60 days, we will have prevented 92,000 people from going to the hospital, and we will have saved 10,000 lives. Now, as miserable as we all are staying home, 60 days is a long time. I feel like if we think about it in terms of how many lives we're saving, it becomes not only bearable, it becomes honestly our duty to our fellow human being. So 60 days at home, 92,000 people not in the hospital, 10,000 lives saved for 60 days at home. That seems like pretty reasonable. And I would suggest that people celebrate Passover and Easter during this special week in our community by thinking about how their behavior and their changes in their behavior is saving lives.
That's a good perspective to put on it. And finally, the last viewer question we have is a question I asked you at 6 o'clock. When will San Antonio reach its peak?
So it's hard to say, and the models change depending on the data that we're putting in, and they're by nature imperfect. We've seen models predicting a peak around the 2nd of May and models predicting a peak around the 28th of May. If we average them out or split the difference, we're looking at a mid-May peak. And so today is April 7th. That puts us 5 weeks away from a peak. That's a really long time. And again, it's good news and bad news. It's a long time, and that's hard to endure. At the same time, what it means is our peak is going to be so much lower than places like New York, New Orleans, and Detroit that we will not overwhelm our healthcare system. And that's really what we're striving for. So in there, San Antonio, we can do this. One team, one dream. Stay home, stay safe, save lives.
Yeah, I love that message. All right, I usually give you the last word, but I think what you said was just so important. I'm just going to let you go. Thank you, Ruth, for your time. Every Tuesday, Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio. We'll be right back.